Will cystoscopy show all bladder abnormalities? This is a common question for those considering a cystoscopy. Cystoscopy is a procedure that allows doctors to look inside the bladder and urethra using a thin tube called a cystoscope. This tube has a light and a camera, which helps visualize the bladder lining for various abnormalities. Cystoscopy can detect several issues, such as tumors, bladder polyps, ulcers, and signs of inflammation or infection. It can also reveal structural problems like diverticula, strictures, or foreign bodies. Additionally, any visible bladder stones can be identified during this procedure. If there is blood in the urine, cystoscopy can help locate the source of bleeding. However, cystoscopy does have its limitations. It may not show all bladder abnormalities. For instance, flat lesions, like certain types of bladder cancer known as carcinoma in situ, can be subtle and might not be easily distinguished from normal tissue. These may require special techniques to detect. Cystoscopy only examines the inner surface of the bladder. Therefore, abnormalities that are located beneath the bladder lining or deeper within the bladder wall may not be visible. Very small lesions or early signs of inflammation can also be missed. Furthermore, cystoscopy does not assess bladder function, such as muscle strength or nerve control, which are important for overall bladder health. Visibility during the procedure can also be compromised by bleeding or debris. If there is heavy bleeding or mucus present, it can limit what the doctor can see. To enhance detection, some techniques can be used alongside cystoscopy. For example, fluorescent cystoscopy uses special dyes that make abnormal cells glow under blue light, improving the chances of spotting flat lesions. Narrowband imaging can enhance the visibility of blood vessels and mucosal patterns, helping to identify suspicious areas. If any areas look concerning during the procedure, a biopsy can be performed to confirm the diagnosis. Because cystoscopy has its limitations, additional tests are often recommended. Urine cytology can check for cancerous cells in the urine. Imaging studies like ultrasound, computed tomography scans, or magnetic resonance imaging can provide a broader view of the bladder wall and surrounding tissues. Urodynamic studies may be used to evaluate bladder function if there are symptoms suggesting functional disorders. For anyone undergoing this procedure, it is essential to understand that while cystoscopy is effective, it is not foolproof. A negative result does not completely rule out all bladder abnormalities. Follow-up tests and monitoring may be necessary, depending on individual risk factors and clinical suspicion. In conclusion, cystoscopy is a valuable tool for visualizing many bladder abnormalities, especially those affecting the bladder lining. However, it does not detect all bladder issues, particularly flat lesions or deeper abnormalities. Enhancements and complementary tests can improve diagnostic accuracy. Always discuss findings and next steps with a healthcare provider to ensure a thorough evaluation tailored to personal health needs.